Your mom feels completely fine, but a routine clinic test shows that her urine is dirty with bacteria. The doctor prescribes antibiotics, and you think you've treated the problem. But what if I told you that the prescription could actually be a medical disaster? In younger people, bacteria in the urine usually means a urinary tract infection. But in older adults, the rules change. As we age, our plumbing changes. The prostates get bigger, the tissues thin, and they create little pockets where bacteria can just hang out. Because of this, up to 1 in 5 older adults walk around every single day with bacteria in the urine. But they have zero pain, zero fever, zero burning. In geriatrics, we call this asymptomatic bacteriuria, and treating it is actually considered bad medicine. Here's why. I want you to think of your parents' bladder like a house. Right now, that house is occupied by harmless squatters. They are peaceful bacteria, they don't cause trouble. Therefore, the house is full. Dangerous, violent germs cannot move in. The harmless bacteria are actually protecting the territory. But when you give your mom a week of antibiotics to clean her urine, you evict all these peaceful squatters and you leave the house completely empty. And what moves in next? Potentially, the superbugs. By treating a number on a piece of paper, you introduce 2 massive risks. The first risk is that antibiotics don't just kill bladder germs, they wipe out the good bacteria in your gut. Therefore, a deadly germ called Clostridium difficile can take over, causing severe infectious diarrhea. And this diarrhea can spread through vulnerable people, such as other care home residents or other hospital inpatients. If you use antibiotics for harmless bacteria today, those germs learn how to fight back. Therefore, 6 months from now, when your mom gets a real kidney infection, the simple pills that treat urinary tract infection won't work anymore. She may need antibiotic injections, and she will end up in the hospital. Now I know what you're thinking. Dr. Lim, what if it is a real infection? And this is the tricky part. Older adults, especially those with memory problems like dementia, often don't feel the typical symptoms of a urinary tract infection. Instead, they show atypical signs. If your parent has sudden confusion, unexplained falls, extreme weakness, or sudden spike in their blood sugar, that may be a sign of an infection. And this may be a cue that we need to treat the urine. But doctor, her urine smells foul. She must need antibiotics. Not necessarily. Dehydration or what they ate or certain daily medication can make the urine smell strong. Smell alone does not equate infection. So here's the golden rule for your next clinic visit. We do not treat the lab reports. We treat the patient. If your parent feels perfectly fine, do not demand antibiotics just to make the urine test look clean. Leave the peaceful squatters alone. In my next video, I'll talk about what to do if your parent is getting recurrent, painful urinary tract infections. Until then, I'm Dr. Lim. Stay safe and I'll see you around. Bye.